What are the critical steps a dental hygienist should take when recognizing and managing a patient experiencing anaphylaxis during a dental procedure? Discuss the rationale behind each step and relevant guidelines. Answer: when recognizing and managing a patient experiencing anaphylaxis, the dental hygienist should follow these critical steps. Immediate recognition. Anaphylaxis may present with symptoms such as difficulty breathing, swelling of the face or throat, hives, or gastrointestinal distress. Recognizing these signs early is crucial, as timely intervention can be life-saving. According to the American Academy of Allergy, Asthma, and Immunology (AAI), the onset of symptoms can occur within minutes of exposure to allergens. To activate emergency response, the dental hygienist should alert the dental team and activate the emergency response protocol. This may include calling 911 or designated emergency services. This step aligns with the guidelines set by the American Dental Association (ADA) for managing medical emergencies in dental practices. Administer epinephrine. If available, epinephrine should be administered immediately, 0.3 to 0.5 mg intramuscularly for adults, 0.1 mg for children, using an auto-injector e.g. EpiPen. This is a critical intervention as it acts quickly to reverse the symptoms of anaphylaxis by constricting blood vessels and relaxing airway muscles. Position the patient. The patient should be positioned comfortably, typically lying down with their legs elevated, unless they are experiencing difficulty breathing, in which case they may prefer to sit up. This position can help improve venous return and reduce the risk of syncope. Monitor vital signs. Continuous monitoring of the patient's vital signs, heart rate, blood pressure, and oxygen saturation is essential until emergency services arrive. The dental hygienist should be prepared to administer additional doses of epinephrine if symptoms do not improve after 5 minutes. Post-emergency care. Once the immediate crisis is managed, the dental hygienist should document the event thoroughly, including the symptoms observed, interventions performed, and patient response. According to the ADA's guidelines on documentation, accurate records can aid in future care and liability protection. By following these steps, dental hygienists can effectively manage anaphylaxis in the dental office, ensuring patient safety and compliance with emergency protocols. What are the primary components of basic life support (BLS) that dental hygienists should implement in a dental emergency, and how do they differ from standard first aid? Answer: the primary components of basic life support (BLS) that dental hygienists should implement in a dental emergency include assessment of the scene and the victim. Ensure the environment is safe, then check for responsiveness by tapping the patient and shouting. This differs from standard first aid, which may not always involve a full scene assessment. Activation of emergency services. Call for emergency assistance immediately, 911 or local emergency number if the patient is unresponsive or breathing abnormally. BLS emphasizes early activation of emergency response, which is less emphasized in basic first aid. Circulation and compressions. If the patient is unresponsive and not breathing, the dental hygienist should perform high-quality chest compressions at a rate of 100-120 compressions per minute, pushing down hard and fast in the center of the chest to a depth of about 2 inches. This is a crucial step in BLS, whereas basic first aid may not include this component. Airway management. The airway should be opened using the head-ill, chin lift method, or jaw thrust maneuver if a spinal injury is suspected. BLS training emphasizes maintaining an open airway as a critical step in performing CPR, unlike standard first aid, which may focus on other aspects. Rescue breaths. After every 30 compressions, provide 2 rescue breaths, ensuring a proper seal over the patient's mouth. This step is specific to BLS, as basic first aid often does not cover rescue breaths. Use of an automated external defibrillator (ED). If available, the AED should be applied as soon as possible, following the prompts provided by the device. BLS training includes specific protocols for AED use, which may not be detailed in standard first aid courses. BLS differs from standard first aid in its structured approach to life-threatening emergencies, emphasizing rapid assessment, circulation, and airway management. Dental hygienists must be certified in BLS to ensure they can provide effective emergency care. Discuss the essential elements of emergency preparedness protocols that a dental office should implement. Why is each element critical for effective emergency management? Answer: essential elements of emergency preparedness protocols in a dental office include training and certification. All staff members should be trained in basic life support (BLS) and emergency protocols. Regular refresher courses ensure that the team remains proficient in emergency response skills as recommended by the ADA and the American Heart Association. Emergency equipment. The dental office should be equipped with emergency kits containing medications e.g. epinephrine, nitroglycerin, and AED, and airway management tools. Having these items readily available enables quick response during a crisis. Emergency contact lists, maintaining updated contact information for local emergency services, poison control, and nearby hospitals is crucial. This information should be posted in visible locations within the office for easy access. Emergency response plan. A written emergency response plan outlining roles and responsibilities for each team member during a medical emergency should be established. This plan ensures organized and efficient action, reducing confusion during crises. Simulation drills. Conducting regular emergency drills helps staff practice their response to various scenarios, such as cardiac arrest or allergic reactions. Drills enhance team cohesion and preparedness, leading to improved outcomes in real emergencies. Post-incident review. After any emergency, a review should be conducted to assess the response and identify areas for improvement. Learning from each incident is essential for enhancing future preparedness. Implementing these elements fosters a culture of safety within the dental office, ensuring that staff are equipped to handle emergencies effectively, thus safeguarding patient health and complying with relevant regulatory standards. Mr. Thompson, a 52-year-old male, arrives for a routine dental cleaning. During the procedure, he suddenly becomes pale, starts sweating profusely, and loses consciousness. As the dental hygienist, what steps should you take immediately following Mr. Thompson's loss of consciousness? Detail your actions and the rationale behind each step. Answer. Upon recognizing Mr. Thompson's loss of consciousness, the dental hygienist should take the following immediate steps. Check responsiveness. Gently shake Mr. Thompson's shoulders and shout to determine if he is responsive. If there is no response, this indicates a potential medical emergency. Activate emergency response. Call for help immediately, e.g. Another staff member should call 911 to ensure that emergency medical services are on their way. Timely activation of emergency services is critical for managing unconscious patients effectively. Assess breathing. Check if Mr. Thompson is breathing by looking for chest movements, listening for breath sounds, and feeling for air on your cheek. If he is not breathing, you will need to begin CPR immediately. Positioning. If Mr. Thompson is unresponsive but breathing, place him in the recovery position to maintain an open airway and prevent aspiration. This position is essential in unconscious patients who are breathing but cannot protect their airway. Monitor vital signs. Continuously monitor Mr. Thompson's pulse and breathing until emergency services arrive. Regular assessment of vital signs is important for identifying any changes in his condition. Prepare for CPR. If Mr. Thompson does not begin to breathe normally, initiate CPR with high-quality chest compressions at a rate of 100 compressions per minute. Follow the compressions with 2 rescue breaths after every 30 compressions. If you are trained to do so, use AED if available. If an automated external defibrillator is available, apply it as soon as possible and follow the device prompts. Early defibrillation is crucial in cases of cardiac arrest. These steps align with the emergency protocols established by the ADA and the AHA, emphasizing rapid assessment, activation of emergency services, and initiation of CPR as vital components of patient care during medical emergencies. What are the critical steps a dental hygienist should follow when managing a patient experiencing a seizure in the dental office? Include the rationale behind each step based on current guidelines. Answer. When managing a patient experiencing a seizure in the dental office, the dental hygienist should follow these critical steps. Stay calm. Remaining calm is essential to effectively manage the situation and provide reassurance to other patients and staff. Panic can exacerbate the situation and impede proper care. Clear the area. Remove any objects or obstacles that could cause injury to the patient during the seizure. This step is critical to prevent potential trauma, as recommended by the National Institute of Neurological Disorders and Stroke. 9s. Protect the patient. Gently guide the patient to the floor if they are standing, placing a soft item under their head to prevent head injury. This intervention is important to minimize the risk of injury during the seizure. Positioning. If possible, turn the patient onto their side to maintain an open airway and allow any fluids to drain. This position can help prevent aspiration, aligning with seizure management guidelines from organizations like the American Epilepsy Society. Timing the seizure. Monitor the duration of the seizure. If it lasts more than 5 minutes, prepare to activate emergency medical services, as prolonged seizures, status epilepticus, require immediate medical intervention. Post-seizure care. After the seizure, provide reassurance in a calm environment. Monitor the patient for confusion or disorientation, which are common post-ictal symptoms. This step is crucial for supporting the patient's recovery and addressing any emotional distress. Documentation. After the event, document the incident thoroughly, including the type of seizure, duration, and any interventions performed. Accurate documentation is essential for ongoing patient care and liability protection. Following these steps enables dental hygienists to effectively manage seizures while ensuring patient safety in compliance with relevant guidelines and protocols. Explain the importance of automated external defibrillators (EDs) in the dental office and outline the steps for using an AED on a patient in cardiac arrest. Answer: the importance of automated external defibrillators (EDs) in the dental office lies in their ability to provide life-saving defibrillation to patients experiencing cardiac arrest. Quick access to an AED can significantly improve survival rates, as indicated by studies from the American Heart Association (AHA), which highlight that defibrillation within the first few minutes of cardiac arrest is crucial. Steps for using an AED on a patient in cardiac arrest: check responsiveness. Confirm that the patient is unresponsive and not breathing normally. If the patient shows no signs of life, proceed to activate emergency services. Retrieve the ED. Obtain the AED from its designated location. Familiarity with the ED's location and operation is vital, as recommended by the AHA. Power on the ED. Turn on the AED by pressing the power button. Most devices will provide voice prompts guiding the user through the process. Attach electrodes. Apply the AED pads to the patient's bare chest as indicated on the pads. One pad should be placed on the upper right chest and the other on the lower left side. Proper placement is critical for effective monitoring and shock delivery. Analyze heart rhythm. Ensure no one is touching the patient and press the Analyze button. The AED will assess the heart rhythm to determine if a shock is needed. If the device indicates a shockable rhythm, proceed to the next step. Deliver shock. Follow the ED's prompts to deliver a shock. Ensure that everyone is clear of the patient during the shock delivery. The shock is intended to restore a normal heart rhythm. Continue CPR. After the shock is delivered, if indicated, immediately resume CPR, starting with chest compressions. Continue to follow the AED prompts for further analysis and shock delivery if necessary. Monitor until help arrives. Continue providing CPR and following AED prompts until emergency medical personnel arrive or the patient shows signs of recovery. By integrating AEDs into emergency protocols, dental offices enhance their capacity to respond effectively to cardiac emergencies, aligning with the AHA's guidelines for emergency cardiovascular care. What are the key components of documentation following a medical emergency in the dental office, and why is meticulous documentation essential for both patient care and legal protection? Answer: key components of documentation following a medical emergency in the dental office include patient identification. Include the patient's name, date of birth, and medical record number to ensure accurate identification. Detailed description of events. Document the sequence of events leading up to the emergency, including patient symptoms, duration of the incident, and specific actions taken by staff. A detailed account ensures clarity and accuracy in understanding what transpired. Interventions administered. Record all interventions performed, including medications administered, dosage and route, CPR details, compressions and rescue breaths, and use of an AED. This documentation is critical for tracking patient response and for legal compliance. Witness statements, if applicable, include statements from other staff members who witnessed the event or participated in the response. This provides corroborating evidence of the emergency management process. Post-emergency condition. Document the patient's condition after the emergency, including any vital signs, consciousness level, and post-ictal state if a seizure occurred. This information is important for ongoing patient care. Follow-up care plans. Outline any necessary follow-up actions, such as referrals for further evaluation or monitoring. Clear follow-up plans are essential for ensuring comprehensive patient care. Signature and date. Ensure that the documentation is signed and dated by the staff member who provided care. This adds legitimacy to the record and is necessary for legal purposes. Meticulous documentation is essential for patient care as it facilitates continuity of care and provides a legal record of the actions taken during the emergency. In the event of a malpractice claim, thorough documentation serves as critical evidence to support the actions taken by the dental team, demonstrating adherence to established protocols and standards of care. After a medical emergency in the dental office, what specific post-emergency care measures should be taken to ensure patient safety and comfort? Explain the rationale behind each measure. Answer: post-emergency care measures following a medical emergency in the dental office should include monitoring vital signs. Regularly assess and document the patient's vital signs, heart rate, blood pressure, respiratory rate, to ensure they stabilize after the emergency. Continuous monitoring is crucial for identifying any complications that may arise post-incident. Providing reassurance. Offer emotional support and reassurance to the patient as they may be anxious or confused following an emergency. Psychological comfort is important for patient recovery and can reduce stress levels, which can impact overall health. Assessing for injuries. Conduct a thorough assessment for any injuries that may have occurred during the emergency, e.g., from falls, seizures. Identifying and addressing these injuries promptly is vital for comprehensive patient care. Ensuring hydration and nutrition. If the patient is stable, offer clear fluids or snacks as appropriate. Ensuring hydration and nutrition is essential for recovery, particularly if the patient has been stressed or immobilized for an extended period. Providing written instructions. Supply the patient with written instructions for home care, including signs of complications that would warrant immediate medical attention. Clear communication aids in patient understanding and compliance with care recommendations. Follow-up appointments. Schedule follow-up appointments as necessary to monitor the patient's recovery and address any ongoing concerns. Continuity of care is important for patient health and well-being. Documentation of events. Ensure that all actions taken during the post-emergency phase are documented in the patient's medical record. Accurate documentation provides a clear account of the patient's condition and interventions performed, supporting continuity of care. Implementing these post-emergency care measures ensures the patient's safety and comfort while aligning with best practices in emergency management as outlined by the ADA. Discuss the current guidelines for CPR in adult patients that dental hygienists must adhere to during a medical emergency. Why is adherence to these guidelines critical in a dental setting? Answer: current guidelines for CPR in adult patients that dental hygienists must adhere to include immediate recognition of cardiac arrest. Recognize signs of cardiac arrest promptly, including unresponsiveness and absence of normal breathing. Early recognition is essential for initiating CPR and improving survival chances. Activate emergency response. Call for emergency medical services immediately after recognizing cardiac arrest. Quick activation of emergency response is critical for obtaining advanced care as soon as possible. High-quality chest compressions. Perform chest compressions at a rate of 1.012 compressions per minute at a depth of approximately 2 inches. Compressions should allow complete chest recoil between each push. High-quality compressions are vital for maintaining blood flow to vital organs. Ventilation support. After every 30 compressions, provide 2 rescue breaths, ensuring a proper seal and allowing for adequate chest rise. Rescue breaths help provide oxygen to the patient and should be included unless the rescuer is untrained or unwilling. Minimize interruptions. Keep interruptions in chest compressions to a minimum. Research indicates that minimizing interruptions maximizes blood flow and improves survival rates. Use of ED. Apply an AED as soon as possible, following the prompts provided by the device. Early defibrillation is critical in treating certain types of cardiac arrest. Adherence to these guidelines is critical in a dental setting because of the potential for emergencies to arise during procedures involving sedation or anxiety-inducing treatments. Ensuring all staff members are trained and proficient in these guidelines enhances patient safety and can save lives in emergency situations. What is syncope, and what are the recommended steps a dental hygienist should take to manage a patient experiencing a syncopal episode during a dental procedure? Provide rationale for each step based on clinical guidelines. Answer: syncope, commonly known as fainting, is a temporary loss of consciousness due to a decrease in blood flow to the brain. The dental hygienist should take the following steps to manage a patient experiencing a syncopal episode. Recognize the symptoms. Be aware of pre-syncopal symptoms such as dizziness, sweating, nausea, and pallor. Early recognition of these signs allows for prompt intervention. Position the patient. If the patient shows signs of fainting, gently lower them to the floor or position them supine with their legs elevated. This position facilitates venous return to the heart, improving cerebral perfusion and helping prevent injury from a fall. Call for assistance. Notify other dental team members to assist in monitoring the patient and preparing for any necessary interventions. Team support ensures that immediate care is provided. Monitor vital signs. Assess the patient's pulse, blood pressure, and level of consciousness. Monitoring vital signs is essential for evaluating the severity of the syncopal episode and determining the need for further medical intervention. Loosen tight clothing. If applicable, loosen any constrictive clothing around the neck or abdomen. This helps improve circulation and comfort during the episode. Provide oxygen if available. Administer supplemental oxygen if the patient is experiencing difficulty breathing or shows signs of respiratory distress. Oxygen can help improve tissue oxygenation during the syncopal event. Stay with the patient. Remain with the patient until they regain consciousness and ensure they are stable before allowing them to sit up or leave the office. Continuous monitoring helps ensure patient safety during recovery. Document the incident. After the episode, document the event thoroughly, including patient symptoms, actions taken, and any follow-up care provided. Accurate documentation is essential for legal protection and future care planning. These steps align with clinical guidelines from organizations such as the American Heart Association, AHA, and the American Dental Association, ADA, regarding the management of syncope in the dental setting. Proper management minimizes risks and enhances patient safety during dental procedures. Mrs. Thompson, a 65-year-old patient, presents with a history of hypertension and is currently taking lisinopril. How should you assess the impact of her systemic condition and medication on her oral health, and what specific oral health considerations should you address during her dental hygiene appointment? Answer: in assessing Mrs. Thompson's systemic conditions, it is crucial to understand how hypertension and medications like lisinopril can influence oral health. Lisinopril, an ACE inhibitor, can lead to side effects such as dry mouth, xerostomia, and altered taste. Xerostomia can significantly increase the risk of caries, periodontal disease, and oral infections due to decreased saliva production, which is essential for maintaining oral health by washing away food particles and neutralizing acids. Additionally, it's important to monitor for any signs of oral mucosal changes or lesions, as systemic medications can sometimes lead to adverse effects. You should also inquire about her blood pressure control, as poorly managed hypertension can lead to complications during dental procedures. Guidelines. The American Dental Association, ADA, recommends that dental hygienists conduct a thorough medical history and risk assessment using tools such as the American Heart Association's AHA guidelines for managing patients with cardiovascular conditions. Furthermore, maintaining communication with her physician may be beneficial for comprehensive care. When creating a comprehensive care plan for a patient with periodontal disease, what factors should be considered, and how would you prioritize the treatment steps? Answer: in developing a care plan for a patient with periodontal disease, several factors must be taken into account. Severity of disease. Assess the degree of periodontal attachment loss and pocket depths. Patient compliance. Evaluate the patient's willingness and ability to adhere to recommended home care regimens. Systemic health. Consider any underlying systemic conditions that may affect healing, e.g. diabetes. Microbial profile. If available, use microbiological testing to identify specific pathogens contributing to the disease. Prioritization steps. Initial phase. Focus on debridement, scaling and root planing, and patient education on oral hygiene. Re-evaluation phase. After a designated period, typically 4-6 weeks, assess the patient's response to treatment. Maintenance phase. Establish a recall schedule based on the patient's risk factors and disease severity. Mr. Johnson, a 45-year-old patient, presents with multiple carious lesions and has a history of alcohol abuse. During the appointment, you notice he is visibly anxious and reluctant to engage in conversation. What clinical decisions should you make regarding his treatment, considering his psychological state and medical history? Answer: when treating Mr. Johnson, it is essential to consider both his physical and psychological health. The presence of carious lesions necessitates intervention. However, his anxiety and alcohol history must be addressed to ensure a successful treatment outcome. Clinical decisions. Build rapport. Initiate a calm, empathetic conversation to help alleviate his anxiety. Using open-ended questions can facilitate better communication. Modify treatment approach. Consider breaking down treatment into manageable segments to reduce stress. For example, prioritize addressing the most painful or urgent carious lesions first. Referral to support services. If his alcohol use is impacting his oral health, referring him to counseling or support groups may be beneficial. Medication consideration. Evaluate whether sedation options are appropriate to help him tolerate the treatment. Guidelines. According to the ADA, treating patients with special healthcare needs requires a multidisciplinary approach integrating psychological support alongside dental care. What are the implications of a patient's uncontrolled diabetes on their dental treatment, and what specific precautions should be taken during dental hygiene procedures? Answer: uncontrolled diabetes can significantly impact dental treatment due to its association with an increased risk of periodontal disease, delayed healing, and a higher likelihood of infections. Key implications include increased infection risk. Patients with uncontrolled diabetes are more susceptible to infections due to impaired immune responses. Delayed healing. Wound healing can be prolonged, affecting post-treatment recovery. Precautions. Blood glucose monitoring. Check the patient's blood glucose levels before treatment, particularly if they report recent instability. Timing of appointments. Schedule dental hygiene visits in the morning when blood glucose levels are likely to be more stable. Post-operative care. Provide clear instructions regarding oral hygiene and signs of infection, as well as the importance of maintaining optimal blood sugar levels for healing. Guidelines. The ADA emphasizes the need for dental professionals to collaborate with the patient's healthcare provider to create a comprehensive management plan that addresses both systemic and oral health needs. Discuss the oral implications of commonly prescribed anticoagulants and the necessary precautions a dental hygienist should take when treating patients on these medications. Answer: anticoagulants such as warfarin and direct oral anticoagulants (DOACs) compose significant risks during dental procedures due to their blood-thinning properties, which increase the risk of bleeding. Oral implications: increased bleeding risk. Patients may experience prolonged bleeding following scaling, root planing, or other invasive procedures. Gingival hyperplasia. Some anticoagulants may lead to gum overgrowth, complicating oral hygiene efforts and increasing plaque retention. Precautions: medical consultation. Prior to treatment, consult with the patient's physician to determine if any adjustments to anticoagulant therapy are necessary. Thorough medical history. Ensure a detailed medical history is recorded, including the type of anticoagulant and duration of use. Hemostasis management. Prepare to manage bleeding with appropriate techniques, such as using local hemostatic agents and ensuring the patient is aware of post-operative care instructions regarding bleeding control. In treating a patient with autism spectrum disorder, as to what strategies should a dental hygienist employ to effectively communicate and manage the patient's anxiety during dental hygiene procedures? Answer: when treating patients with autism spectrum disorder, it is crucial to create a supportive environment and employ effective communication strategies. Visual supports. Use visual schedules or social stories to prepare the patient for the appointment, explaining what to expect during each step of the visit. Desensitization techniques. Gradually introduce dental instruments and procedures to reduce anxiety. This can include letting the patient hold tools or use them on a model. Routine establishment. Consistency in appointment scheduling and the same dental team members can help build trust and comfort. Clear communication. Use simple, direct language and nonverbal cues to enhance understanding. Guidelines. The ADA recognizes the need for specialized training and communication strategies for patients with special healthcare needs, including the use of behavioral management techniques and individualized care plans. How should a dental hygienist approach ethical dilemmas that arise when a patient refuses a recommended treatment plan due to financial constraints? Answer: when facing ethical dilemmas related to treatment refusal, dental hygienists must balance the obligation to provide care with respect for patient autonomy and financial realities. Approach: open dialogue. Initiate a conversation with the patient to understand their concerns and the reasons for declining treatment. Education on options. Provide information about the consequences of delaying or refusing treatment and discuss alternative treatment options that may be more affordable. Referral to resources. Suggest community resources or financial assistance programs that could help alleviate the financial burden. Documenting decisions. Ensure that the patient's refusal of treatment is documented in their medical record, including the rationale provided by the patient. Guidelines. The ADA's Code of Ethics emphasizes the importance of informed consent and respect for patient autonomy, while also highlighting the responsibility of dental hygienists to advocate for their patients' health. What steps should a dental hygienist take to critically analyze clinical findings when diagnosing periodontal disease, and how do these findings influence treatment decisions? Answer: critical analysis of clinical findings is essential for an accurate diagnosis of periodontal disease. Steps include comprehensive assessment. Conduct a thorough assessment including probing depths, clinical attachment levels, and bleeding on probing. Radiographic analysis. Evaluate radiographs to identify bone loss patterns and the presence of any periodontal defects. Risk factor evaluation. Assess systemic and environmental risk factors including smoking status and diabetes. Integration of data. Combine clinical findings with patient history to develop a comprehensive diagnosis. Influence on treatment decisions. The severity and extent of periodontal disease determined through these findings will influence whether to initiate non-surgical treatment, scaling and root planing, or to refer to a periodontist for surgical intervention. ECA case where a patient presents with both periodontal disease and active caries. How should a dental hygienist prioritize the treatment, and what factors should influence this decision? Answer: when addressing both periodontal disease and active caries, prioritization should be based on several factors. Severity of periodontal disease. If the patient has advanced periodontal disease, immediate attention should be given to the periodontal condition to prevent tooth loss. Extent of carious lesions. Evaluate the extent of caries. If lesions are cavitated and symptomatic, they may need urgent treatment to alleviate pain and prevent further damage. Patient symptoms. If the patient reports pain or discomfort, that should be prioritized to enhance patient comfort and compliance. Overall health status. Consider any systemic conditions that may affect treatment timing and outcomes decision-making. A sequential treatment plan may be established, beginning with addressing the most urgent issue, e.g. symptomatic caries, followed by periodontal therapy with ongoing assessment and adjustment based on patient response. Describe the process a dental hygienist should follow to adjust a treatment plan for a patient who is non-compliant with home care recommendations for managing periodontal disease. Answer: when faced with a non-compliant patient, a dental hygienist should follow a systematic process. Assess reasons for non-compliance. Engage the patient in dialogue to understand barriers to compliance, which may include lack of knowledge, financial constraints, or physical limitations. Reinforce education. Provide clear, tailored education about the importance of home care in managing periodontal disease using visual aids or demonstrations to enhance understanding. Modify the treatment plan. Consider adjusting the frequency of professional cleanings or introducing more frequent follow-up appointments to encourage accountability. Set realistic goals. Collaborate with the patient to establish achievable goals and a realistic home care routine that fits their lifestyle. Follow-up and reevaluation. Regularly evaluate the patient's oral health status in response to the modified plan and remain flexible to further adjust as needed based on their progress. Describe the different classifications of periodontal diseases as per the American Academy of Periodontology. How does this classification impact the treatment approach for patients? Answer: the American Academy of Periodontology classifies periodontal diseases into several categories: gingivitis, chronic periodontitis, aggressive periodontitis. Periodontitis is a manifestation of systemic diseases, and necrotizing periodontal diseases. Gingivitis is characterized by inflammation of the gingiva without attachment loss, typically reversible with improved oral hygiene. Chronic periodontitis is more prevalent, marked by clinical attachment loss and bone loss, often requiring non-surgical periodontal therapies such as scaling and root planing. Aggressive periodontitis can occur in adolescents or young adults and may progress rapidly, necessitating more intensive treatment and possibly systemic antibiotics. Periodontitis is a manifestation of systemic diseases, includes conditions like diabetes that exacerbate periodontal disease. Necrotizing periodontal diseases involve tissue necrosis and are often associated with systemic conditions like HIV. Understanding these classifications helps dental hygienists tailor treatments and anticipate patient needs, enhancing patient outcomes and adherence to recommended therapies. Explain the mechanisms of action for local anesthetics used in dental procedures. How do these mechanisms impact the selection of anesthetic agents based on the type of procedure being performed? Answer: local anesthetics work by blocking sodium channels in the neuronal cell membrane, preventing the propagation of nerve impulses. The primary mechanism involves the reversible inhibition of sodium ion influx during depolarization, effectively blocking the transmission of pain signals. When selecting an anesthetic, dental hygienists consider factors such as duration of action. Procedures requiring prolonged anesthesia may benefit from agents like bupivacaine, while shorter procedures may use lidocaine. Potency. More potent anesthetics may be preferred for invasive procedures. Patient factors. Allergies, medical history, and the potential for systemic toxicity are crucial considerations. Understanding these mechanisms allows hygienists to make informed decisions on anesthetic choices, enhancing patient comfort and procedural efficiency. Discuss the principles of radiation safety and protection in a dental setting. What are the key regulatory guidelines that dental hygienists must follow to minimize patient and operator exposure to radiation? Answer: radiation safety in dentistry is governed by several principles and guidelines, including ALAR, a principle as low as reasonably achievable. This principle aims to minimize exposure by optimizing the use of radiation. Practitioners should ensure that every radiographic procedure is clinically justified. Use of protective barriers. Operators should use lead aprons and thyroid collars for patients to shield against unnecessary exposure. Proper equipment maintenance. Regularly calibrating and maintaining X-ray machines ensures they operate at optimal efficiency, reducing scatter radiation. Regulatory compliance. The Occupational Safety and Health Administration (OSHA) and the National Council on Radiation Protection and Measurements (NRP) provide guidelines for safe practice, including maximum permissible doses for radiation workers and patients. Adhering to these principles not only protects patients but also fosters a safe working environment for dental hygienists. Mr. Thompson, a 55-year-old patient, presents with significant plaque buildup and bleeding upon probing during a routine cleaning appointment. He has a history of hypertension and is currently taking medication. As a dental hygienist, how should you assess his periodontal status and plan for his treatment? Answer: in assessing Mr. Thompson's periodontal status, a comprehensive examination should be performed, including clinical examination, document probing depths, attachment loss, and gingival inflammation. The presence of bleeding on probing is a critical indicator of periodontal disease. Medical history review. Assess the impact of his hypertension medications, as certain antihypertensives may contribute to gingival hyperplasia. Radiographic evaluation. Obtain periapical or bituing radiographs to assess the bone levels around the teeth. Based on this assessment, a treatment plan may include non-surgical therapy, initiating scaling and root planing to reduce plaque and calculus, coupled with patient education on improved oral hygiene practices. Referral to periodontist. If advanced periodontal disease is diagnosed, referral may be necessary for surgical intervention. Follow-up care. Schedule regular follow-ups to monitor periodontal health, adjusting the treatment plan as necessary based on his response to therapy. Explain the pathogenesis of chronic periodontitis, including the role of specific bacterial pathogens and the host's immune response. Answer: chronic periodontitis is a multifactorial disease characterized by inflammation of the supporting structures of the teeth. The pathogenesis involves bacterial biofilm formation. Pathogenic bacteria such as Porphyromonas gingivalis and Tannarella forsythia colonize the dental plaque. These bacteria produce virulence factors that contribute to tissue destruction. Host immune response. The host's immune system responds to the bacterial challenge, often leading to an exaggerated inflammatory response. Cytokines such as IL-1 and TNF play a significant role in mediating inflammation and activating osteoclasts, which leads to bone resorption, tissue destruction. Over time, the combination of pathogenic bacterial activity and the host's immune response results in the destruction of periodontal tissues, including alveolar bone and periodontal ligament. Understanding the intricate balance between bacterial factors and the host's immune response is crucial for developing effective therapeutic strategies in managing chronic periodontitis. Discuss the biocompatibility considerations of dental materials used in restorative dentistry. What tests and standards are typically employed to assess their safety? Answer: biocompatibility of dental materials is essential for ensuring patient safety and effective outcomes. Key considerations include material selection. Materials such as composite resins, ceramics, and dental alloys must be evaluated for potential cytotoxicity, sensitization, and irritation. Testing standards. The International Organization for Standardization (ISO) provides guidelines for biocompatibility testing, particularly ISO 10993, which outlines the biological evaluation of medical devices. Common tests include cytotoxicity testing, evaluates the material's effects on cell cultures. Sensitization testing assesses the potential for allergic reactions. Irritation tests determine the potential for irritation to tissues. These assessments ensure that the materials used in restorative procedures do not adversely affect the patient, promoting safe and effective dental care. What are the critical steps in infection control procedures that dental hygienists must follow when handling dental materials in clinical settings? Answer: infection control is paramount in clinical settings to prevent cross-contamination. Key steps include hand hygiene. Perform hand washing before and after patient contact using an alcohol-based hand rub or soap and water. Personal protective equipment (PPE). Utilize gloves, masks, goggles, and gowns when interacting with patients or handling materials to protect both the patient and the hygienist. Sterilization and disinfection. All reusable instruments should be sterilized according to CDC guidelines, while surfaces and non-critical items should be disinfected using appropriate agents such as EPA-registered disinfectants, material handling, properly dispose of single-use items, and follow protocols for cleaning and maintaining dental materials to prevent contamination. By adhering to these infection control procedures, dental hygienists help ensure a safe environment for both patients and staff. Evaluate the significance of surgical versus non-surgical periodontal therapies. Under what circumstances should a dental hygienist recommend surgical intervention? Answer: non-surgical periodontal therapies such as scaling and root planing are typically the first line of treatment for periodontal disease. These methods aim to reduce inflammation and plaque accumulation and are often sufficient for cases of mild to moderate chronic periodontitis. Surgical intervention may be warranted in the following circumstances: severe periodontal disease. Patients with significant attachment loss and deep periodontal pockets may benefit from surgical techniques such as flap surgery or osseous recontouring to access and remove calculus and infected tissue more effectively. Non-responsive to non-surgical therapy. If a patient does not respond adequately to initial non-surgical treatment, surgical options may be necessary to achieve better outcomes. Aesthetic considerations. In cases where periodontal defects affect the appearance of the smile, surgical techniques like gingival grafting may be employed to restore aesthetics. The decision to recommend surgical intervention must be based on a comprehensive assessment of the patient's periodontal condition, overall health, and treatment goals. Assess the effectiveness of non-surgical periodontal therapies in the management of periodontal disease. What factors influence the success of these therapies? Answer: non-surgical periodontal therapies, primarily scaling and root planing (SRP), have been shown to be effective in reducing periodontal inflammation and probing depths in patients with chronic periodontitis. Factors influencing the success of these therapies include patient compliance. Adherence to post-treatment oral hygiene recommendations is critical for maintaining improvements. Extent of disease. The severity and extent of periodontal disease can affect treatment outcomes, with more advanced disease potentially requiring additional intervention. Biological factors. Host responses, such as immune system efficacy, can impact healing and the success of non-surgical therapies. Studies have shown that patients who engage in regular follow-ups and maintain good oral hygiene practices post-treatment experience better long-term outcomes. Examine the advantages and limitations of digital imaging technologies in dental radiography. How do these technologies impact diagnostic capabilities and patient safety? Answer: digital imaging technologies, such as digital radiography, offer several advantages over traditional fill-based methods. Enhanced image quality. Digital images can be manipulated for contrast and brightness, improving diagnostic capabilities. Reduced radiation exposure. Digital sensors are more sensitive to radiation, allowing for lower doses during exposure. Immediate availability. Images can be viewed and shared instantly, facilitating quicker diagnosis and treatment planning. However, limitations include initial costs. The upfront investment for digital imaging equipment can be significant for dental practices. Training requirements. Staff must be trained to use digital systems effectively to avoid errors in image capture and interpretation.